All right. In this section, we're actually stealing a chapter out of a different textbook, but in this section we're talking about public health and EMS. So when we're talking about public health, some of this is briefly touched on earlier in your textbook, but I think it leaves a lot to be desired. So we're going to just touch on a few of these items in this presentation. There's not really much reading to go on with it. I would recommend that you maybe take a better look over the PowerPoint that is present here. So EMS providers have an important role in injury and illness prevention. We haven't always looked at it that way, but a lot of it is similar to that of the fire service. And fire service, I think most people would say they would much rather not have to go to a fire than have to go to a fire and have somebody lose their property and their life. So it's much better if we don't ever have to deal with patients in severe emergencies. They're always going to happen, but some of them can be prevented. So public health really is a health and wellness system. There's a lot of different levels to public health. There's the United States Department of Public Health, which is actually or the Public Health Service, which is one of the uniformed services similar to the military and NOAA. But public health reaches down to the local levels as well. There's state health departments and local health departments. So, and their primary goal is preventative medicine, and then getting at least some well child stuff and well patient cares out to people who may not have necessarily access to a lot of other health services. So injuries is a huge public threat that we deal with, whether they're intentional or unintentional. Injuries historically are reported under distinct umbrellas. We look at falls versus motor vehicle accidents, stabbings, shootings, so on and so forth. So when we look at some of these public health threats, you can see that there's a significant number of suicides, almost 35,000 suicides a year, being intentional, another just over 18,000 in homicides, and then undetermined, somewhere around 5,000. When we look at the unintentional and intentional, they're working to try to improve mental health systems, but it's a problem that's becoming bigger and bigger every moment. When we look at the unintentional side, transportation accidents, basically motor vehicle collisions, accommodate at least a third of all of those, if not a little over a third. Accidental poisoning, surprisingly, quite a few of those, but and the majority of those in pediatrics. And then accidental falls create another significant chunk of the pie there. So we have the potential to be involved with some of these preventative items, and particularly during EMS week, it's a great time for us to put on some things. We can be proactive throughout the year, though. We can offer to go and visit people who maybe live in an unsafe environment, try to help them out, put ourselves at the disposal of public health in case they need some assistance. So many health experts consider injury the largest problem facing U.S. today, and we know if we go back to Chapter 1 when we talked about the humble beginnings of EMS, we know that EMS was created by that white paper that was basically called Accidental Injury, the Modern Pandemic in Society, basically is what it came out and said. And so we don't take care of people, so we don't have any systems that will take care of them on the way to the hospital, so people are dying. So public health looks at things like years of potential life lost, and they a lot of times will assume that you're going to work till you're 65, and it's easier to measure death rates than morbidity rates. It's easier to say who's died than who has the potential to die. So each year 7 out of 10 Americans die from chronic disease. A lot of these are basically because of American lifestyles. We're sedentary, we eat poorly, we do a lot of things that we shouldn't be doing, and it's threatening us. So there's some additional health threats that include asthma and influenza, water, seafood contamination, lack of sanitary conditions. Those bottom two can be a potential issue in America. They don't tend to be well known and they don't tend to be widespread, but they do exist. So there's a number of places that form recommendations and work with public health departments, and so there's three major areas of reform they're looking at. Policies and funding. How do we fund this? This is a highly underfunded area. Is how do we pay for healthcare for the masses? Now with Obamacare and whatnot coming along, we'll see if that changes at all. Strengthening that public health system, having better monitoring of what's going on in their communities, and doing something about it. And then all access systems, so people can get the health care that they need. Maybe they're not going to get everything that they need, but they get an into the system. So we want to try to prevent adverse outcomes as major goal. So if we can try to prevent people from having a fall that leads to pneumonia, that leads to them becoming either dying or becoming incapacitated for the rest of their lives, that's great. So can we do some injury prevention? Car seats, seat belts, airbags, so on and so forth. Prenatal care, that's another huge push of public health. There's a lot of well mom and well baby clinics that public health is involved with, as well as disease screening. Most public health departments, local public health departments, do a lot of disease screening, particularly for venereal disease or sexually transmitted diseases. So there's various layers of public law and regulation. It includes HIPAA, which we know has to do basically with a lot of privacy, various state laws about who can do what, whether a minor can get birth control or a minor can seek care for their pregnancy or an abortion or what have you. It all varies from state to state. We have the World Health Organization's framework convention on tobacco control, trying to reduce the numbers of tobacco users. Of course, we have FDA regulations that oversee many of the treatments and medications that get used in healthcare. So there's been a lot of collaboration that brings EMS into the mix here. We have the National Association of EMS Physicians, the American Public Health Association, and the National Association of, it's actually state EMS officials instead of directors. It formerly was directors, but the National Association of State EMS Officials all regularly have discussions on how do we make this a better world and how do we get EMS involved. So September is National Preparedness Month. There's Get Ready Days. I remember, now that I'm recording this in November, but just a couple months ago I remember hearing numerous commercials about people doing things to be prepared for disaster. So various different activities that can occur, and a lot of it also depends on what's your society, what's your community potentially have to deal with. So not very likely that we're going to talk about, say, well, earthquakes aren't out of the picture here, but they're not very common and they're not very big when they do occur, but tornadoes are. So EMS providers can lead or support interventions. We have to be an advocate. We have to be a practitioner as well. And illness and injury prevention really do have similar techniques. If we can make people aware of some of the reasons why things occur, and a lot of times when you hear, somebody gives you a lecture on something, they give you the don't do this, don't do that. They don't really give you the why. And I think that the why really helps people understand, oh, that makes a little sense why we should not be doing that. So there's that modern white paper, that white paper we talked about, Accidental Death and Disability, the Neglected Disease of Modern Society, which is which really got EMS born. Injury prevention has always included EMS, and there's a role for every provider depending on what we end up deciding to do. Number of reasons we should be involved with it. Number one, it reflects a community composition. It shows a combined force of the healthcare profession. We are medically sophisticated. We have a lot of cool toys. We are high profile role models. EMS providers are consistently in the top 5 most respected professions in the United States. And then we have access to the community. We're the only healthcare service in every community. In some way, shape, or form, there's EMS that touches every community. There is not a doctor's office in every community. There's not a hospital in every community. There's not a nursing home in every community. But there is EMS. We can be looking at risks and what sort of risks are out there and how can we help reduce those risks. I think a good example of this in EMS usually plays into is Operation Prom, or whatever it's called in your local community, where the fire and EMS systems and probably law enforcement and hospitals and potentially helicopters get involved, showing the teenagers around prom time why they should not be drinking and driving, texting and driving, so on and so forth. So the 4 E's of injury prevention: we have education, telling people about the potential dangers. We've got to make sure that our messages are effective. They're not just a scolding. Enforcement, so legislation and regulation. This is why law enforcement officers write you a ticket if you're not wearing a seatbelt. Engineering, so the engineers that are developing roadways, that are developing highways, that are developing vehicles, or certain protective devices, are all working in that area to help make it safer. And then economic incentive. Well, economic incentive, I guess, could be looked at a couple of different ways. I mean, number one, if you can save some money on your vehicle. I traded in a vehicle recently, and traded in a 10-year-old vehicle for a basically brand new vehicle, and my insurance rates went down because the vehicle was a safer vehicle. So that's an economic incentive. Additionally, I guess you could look at if you tend to drive close to the speed limit because you really don't want to pay a fine, that would be another economic incentive. Kind of goes with enforcement, but same sort of thing. So the value of automatic protection: passive interventions are the most successful. So we don't even have to think about it. We don't have to make an effort. For a while there, cars had automatic seat belts. They were kind of a pain. They were not a one-size-fits-all, so they didn't really work very well. But we have some other things that have come about. So airbags, we don't have to do anything. We don't have to arm our airbags. We maybe have to think about turning them off if we drive a pickup truck, and then maybe back on after we've removed the kiddo from the seat. But even now, most of the seats have a trigger in them that if it weighs over so much, it's on. So as visual models that describe health problems and how to approach it, so we start to look at things like, so we have the host, we have the agent, and what happens, the environment. And we're not going to spend much time on this, but just understand that they look at pre-event, event, and post-event. And EMS is most commonly involved in the event. We're not spending as much time in the post-event. I guess we're really the transition from event to post-event. But they want to see us more active in pre-event. So trying to prevent instead of dealing with the mop-up. So data collection and injury surveillance. So when you're writing your run reports, almost all states now report into a national clearinghouse with certain parts of their data they get off of run reports. And it helps to drive the EMS profession. It helps in the different research areas that EMS is working in, and helps drive our practice. It also helps show a truer picture of what's going on in America for injuries and illness and whatnot. So to get started in your community, you need to understand, what are your injury and illness patterns? Do you have a particularly high pattern of something that you deal with on a regular basis? So that's information you can gather and compare to others in your state or your local region. Characteristics of your population and your environment. Rural America, the population tends to be dwindling and aging very quickly. What sort of types of risks are present? Well, in this part of the world, our biggest risk tends to be motor vehicles and agricultural. And then again, it goes on to say, hey, contact your regional or state EMS departments, public health. They can give you more data so you can start to evaluate what's going on. So intentional injuries, assaults are more likely to be fatal in the United States than they are in other places. There's a certain risk connected with the intentional violence, and EMS providers often get somewhat involved in the mix here. We obviously have a duty to do some reporting and noting risk factors, although we tend to be second fiddle. Unintentional accidents, children are very high risk. Motor vehicle accidents still rank very high. Poisonings, many of those are children. Firearms, a lot of those are also children. They just don't fully understand. So they don't understand the seriousness of the nature. Other risk factors for children tend to be lower socioeconomic status. They don't concentrate as much on prevention in the homes. They don't work as much on child safety features of the homes and whatnot. Injuries are more likely when there's water or heat, toxic agents, or high potential energy, such as firearms. School injuries really are not common. Unintentional injuries are the greatest risk. And then priority prevention efforts are injuries with the highest mortality rate, so we find out what's killing most of the kids in our community. Illness prevention, that's again talking about sedentary lifestyles, unhealthy diets, STDs, so on and so forth, tobacco. So trying to get the word out, hey, that this isn't gonna turn out well. So your 5 steps in a prevention program include conducting a community assessment. So finding out, what does your community have a problem with, or what is that perceived as a major problem. Define what that problem is in quantifiable terms, or in very specific terms that you can pin it down. Say, here is our problem. Set our goal. Say, what do we want to see? Maybe we have a 60% death rate in motor vehicle accidents. I think that's probably really high, but 60% of our motor vehicle accidents are fatalities. We may say we want to alter that. We want to bring it down to 30%, and set a date. That's what we're really striving for. Sure, we would like to get it down to 0, but you need to take baby steps to get there. So look at your objectives. How are we going to do this? What are we intending to do? How are we going to measure what we've done? So, and that's really planning and testing. So making sure we're accomplishing. So we're going to run this data every 3 months and see where we're at. And then, of course, then you have to evaluate and implement what you're considering doing. So it's the evaluation portion that tells you if you're actually doing any good. So how are you going to fund it? Funding often has to be creative. We have to be innovative in the way we get this. So sometimes media partners, sometimes we're looking for large employers, maybe community foundations and whatnot that have some money, and then network with other prevention programs. Maybe there's somebody close by that's doing something similar that would love to have some assistance and would work with you. So EMTs and paramedics, they can be involved in prevention to some extent. Paramedics can be doing things like immunizations at the EMT level. That's not as likely that that's going to happen, but there are other things that EMTs can be doing. They can be doing a lot of engineering controls in people's homes, and very few calls really honestly require us to go lights and sirens. So in many cases we actually are doing kind of some routine healthcare stuff. So education for EMS providers, got to understand the fundamentals of prevention. You got to be thinking about that. That is is the way we're going. It's not, we're just going to turn a blind eye to what's causing this and just respond when we have to. We have to step up and say, we need to do something about it to change what's happening to our fellow citizens. So we can use teachable moments. So be articulate and reinforce what happened. So maybe it's a close call that you've gone on, and somebody didn't get hurt, but they certainly could have. Is there a tactful way for us to take a moment and say, can you now see the dangers of this? Don't forget to collect your data, and in certain cases, reporting that data on to where it needs to go. The data will help support your goals. A lot of times we start with our pre-hospital care reports, but there may be supplemental reports we use as well. You've got to be a role model. People already look up to you, so if they see you driving around texting, they see you driving around with no seatbelt, they see you walk out of the bar stumbling around and get in your car and drive, that does not send the right message to your community. Because if you're the safety guru of your community and it doesn't matter to you, why should it matter to me? All right, so there's the summaries here. I think we need to dwell much on that. All right.